Hello, everybody. This is Nate Gustafson. So glad to be joining you today for this special presentation on MAID and its moral impact. This is geared for you all who are healthcare heroes, whether you're nurses, whether you're cooks in the kitchen, whether you're CNAs, whether you're RNs, LPNs, social workers, chaplains, healthcare workers of all shapes and sizes. And we want to also make sure that we have a special shout out and special recognition that there are so many wonderful volunteers out there, whether they're in the hospice community serving as volunteers, whether they're volunteers from faith communities, whether they're volunteers in the neighborhood who are looking after elders in your neighborhood. We want to make a special shout out to you as well, because you are part of this healthcare team and you're a part of this important work of supporting people as they face the end of life journey. And one of the complications that can come up during the end of life journey is for those of us who live in a state where aid in dying is a legal choice and legal option for people who have a terminal illness. We want to help you all as healthcare workers to be able to navigate the moral and ethical side of this issue. We know that there's lots of resources out there who help with the nuts and bolts of what allows a person to qualify for such a program, what the steps are to take part in the program, what are the medications that are prescribed, how a person and their family goes through those steps in the process. But we want to focus on the caregivers. We want to focus on you all who are healthcare heroes, team members, volunteers, support staff who might be unfamiliar with this, who might be really wrestling with it yourself for what it means for your beliefs, your values, your ethical considerations. And so this presentation is for you. We're going to help you learn how to navigate the moral and ethical side of medical aid in dying and similar programs across the country, some of them known as Death with Dignity. And so we want to help you navigate that well so that we can help you be there and show up well for those who are in their time of need. Let's get started. So medical aid in dying is relatively new still for many people. In 1994, Oregon passed the first Death with Dignity law. It took a number of years before they were allowed to implement it. They first implemented this law in 1998. And then in the state I live in, Colorado, we were the fifth state to pass a Death with Dignity law. And then this year during the legislative session in 2024, Colorado amended the law. They have a shorter waiting time now between the requests that someone has to make for their prescription. And they also have allowed for telehealth and allowed for more access in rural communities to nurse practitioners, physician assistants who may be able to help with the process of completing a MAID application and the screening. So for whatever state you're living in, I would highly encourage you. A great resource to understand more about this is Death with Dignity. Also Compassion and Choices as another resource out there. But what we're looking at is what would be classified as an ethical dilemma. And an ethical dilemma is one of those situations where there's a conflict between two or more values or virtue-driven interests. Now, there could be the rock and the hard place between two really, really difficult, what might feel like hard decisions, where you feel like you're really not in a win-win situation. You might feel like you're in a lose-lose situation. Ethical dilemmas can also be in a win-win situation where you're just torn between what's good and what's great, what's better, what's best. And so an ethical dilemma, as it relates to medical aid in dying, is that some people consider this death with dignity, and others feel like this is assisted suicide and should not be promoted and should not be legalized in all the states that it is. So as caregivers, you all are front and center with people who are struggling, who are hurting, who are suffering, and that can have an intense emotional, spiritual, mental, physical impact on your own heart and soul, your own well-being. And so I want to encourage you to really think about this and realize that we are all at such a high risk for compassion fatigue, such a high risk for burnout, such a high risk for just losing our care. And that's the last thing that we need in this world, is to lose our care, lose our compassion. I don't want to see that for you. I want to see you be able to continue to show up with deep empathy, with deep care and concern for each and every person and each and every family member that you serve. Again, whether that's just as a visiting angel in the community, whether that's as a nurse in an ICU unit, whether that's a social worker in a nursing home setting, whatever your role and part of the team is, I want to help you navigate these difficult dilemmas with as much grace and compassion as we can. Because if we don't grow in our awareness of how these difficult dilemmas affect us, then again, we're going to increase the likelihood of our compassion fatigue, our burnout, our emotional, physical exhaustion is going to impact the way that we show up and care for others. So what I want to do is walk through the steps of what we're going to do here today. We want to help you, again, as professionals, as volunteers, as angels in the community. We want to help you spread your wings and understand that this is a difficult scenario. We know that it is so, there are so many layers and so many levels of hurt and concern that can happen when someone is facing an end-of-life journey, whether they're 50 years old and have stage 4 pancreatic cancer, or whether they're 105 and have lived super healthy up until 104 and now have their lungs and their heart giving up on them. They've lost the ability to walk. They've lost their ability to function at the high level that they had for 104 years. And we want to make sure that we wrap our arms around these people and that we really put ourselves in their shoes to understand what it's like for them to be at this end of life journey, and then what it is for us as caregivers, what it is for us as a healthcare team, as professionals and volunteers. So the steps that we're going to take are really adapted from the book Moral Choices by Scott Ray, and he lays out a beautiful system of just how do we make wise moral decisions? How do we make ethical decisions about how we do or don't do certain things, how we act or react in certain scenarios when we're faced with these dilemmas. So the first thing that we're going to do is we're going to take a 360-degree look around the entire issue and the situation of end of life and aid in dying. We're going to determine the virtues and the values that are going to help us to make our decision about how we as healthcare professionals and volunteers feel like we can show up in the best way for these people. And then 3, we're going to look at all the options that a patient and team members have. And again, these are all the options in quotes. We're not going to be able to uncover every last option, every last scenario, but hopefully we'll cover enough of these scenarios so you can start to see where your values and where your virtues may lead you to help support and serve and care for someone in this end of life journey who's considering an aid in dying choice, versus where you may not feel like you're best suited to help and support someone in that situation. So as we look at all the options and we're going to compare these alternatives and we're going to consider the consequences. What's the consequence if I choose to act in this way? What's the consequence if I choose to act in another way? What's the consequence if I don't act at all in this situation? And finally, we're led to make a decision as best as we possibly can, understanding that sometimes our minds change, sometimes depending on circumstances and where we're at in life and what's going on, our decision might look differently between now and even 6 months from now. So we remember that we are working with fragile hearts. We are working with deeply loved, wonderfully made, valuable individuals who are facing an end-of-life journey. And for those of our people who are considering aid in dying, often they must be of capacity. They must be able to make their own decisions. They must understand the realm and the consequences of what they're choosing to opt into. And so again, these are people who are fully aware of the circumstances that they're facing, understanding that they're diagnosed with terminal disease, understanding that the prognosis is slim, that they're possibly facing the real likelihood that they could end their life of their own choosing, or they could let Mother Nature take its course and risk the possibility of enduring an intense amount of pain and suffering along the way. So we acknowledge that this decision is not an easy one. We acknowledge that there are lots of different opinions. There are lots of different viewpoints. And so we're not here necessarily to state that this is right or this is wrong. We're here to help you navigate this so that you can make an informed decision and so that you can respond and help these people with as much compassion and care and bring as much love and support to them as possible. So as we walk through this process, we understand it can be emotionally distressing for those of us who are closest to the people who are making this decision. So let's begin with taking a look at a 360-degree view of medical aid in dying. First, we have to gather the facts. And again, I'm not going to go into all the details, but just to hit the highlights, the people who are eligible for aid in dying, they must be diagnosed with a terminal disease, 6 months or less prognosis usually. Second of all, they have to have capacity to understand their disease process. They have to have capacity to understand the risks of what they are selecting to get into if they pursue a MAID program. And they have to understand that there are certain laws and certain realms and policies and procedures that govern this process state by state, situation by situation. So again, it helps us as caregivers and healthcare team members to know as much as we possibly can about a certain individual's what they're dealing with. Again, what they already believe that they want to do, what they think that they're going to do. It's so important that we gather all the facts. And we also need to gather all the facts for ourselves, gathering all the facts for what we believe about this situation, what we understand about these situations, what we need to gather the facts for us as well. Because facts can change depending on where you live, depending on the type of situation that you're in. Then secondly, we want to listen with curiosity. It's always so critical and so important to treat people with love and respect. And part of that is to listen with curiosity, fully understand what is it that they're looking to do, what are their options that they're considering, what are their struggles, what are their support system needs. We're just listening to the whole story as best as we possibly can so that we can understand what a person is going through. And then we're also listening for ourselves so that we can fully understand and gather. After we've gathered the facts and we're listening to the facts with curiosity, we want to have as clear a picture as we possibly can of what is taking place with this person, their family, as they consider this very difficult decision. And then we're naming the issue. And this is so critical. Once you've engaged with deep listening, once you've gathered these facts, it's so important to name the issue at hand for the patient as well as you as the team member. So if the facts are that Mr. Smith is an 80-year-old gentleman who up until a year ago was perfectly healthy, was independent, he and his wife were living the great retired life and in the beautiful independent senior living community, until all of a sudden there became just a lot of unknown issues with pain, with shortness of breath, with exhaustion. And as they got a workup, they discovered that there was lung cancer that Mr. Smith was dealing with. And the lung cancer had spread to other vital organs. And unbeknownst to them, he had never smoked. He had never had a problem like this a day in his life. And as he began to wrap his mind around this terminal diagnosis, stage 4 inoperable cancer, he began to realize that there's the real possibility that he could lose control of his life, he could lose control of his body, he could lose control of his independence, and he could end up really facing an extreme amount of pain and suffering at all levels, physical, emotional, spiritual. And so he and his family really are wrestling with what do they want to do? Do they want to pursue treatment? Do they want to pursue hospice care? Or do they want to pursue medical aid in dying? And so for them, the issue is, do I take the risk of letting Mother Nature take its course and trust that with pain medicine and healthcare, I can pass away peacefully and with dignity? Or do I want to take matters into my own hand and say, you know what? I'm in control of my body, in control of my life, and I'm going to make the best decision possible, and I'm going to take part in a MAID program. So that's naming the issue for the patient and the family. As the caregiver, this may all be so new to you that you're just like, my issue is I don't understand any of it. And that's fair. You're naming the issue is that you just really are trying to understand what this is all about. Maybe for you can't even fathom that somebody would choose to take their own life as a result of a MAID program or accept the assistance of the medical community for the prescriptions that would end their life. Or maybe you can't understand why on earth somebody would be against this. So whatever the issue is, it's important to name it, and important to name as much of it as you possibly can so that you're just very clear. We're getting a very clear picture for the patient and their family, the individual, the loved one, the neighbor, the friend, the family member, as well as ourselves. It's so important to get a clear picture of the issue, and then we frame the picture. So again, framing the picture just holds it in sight for us. It holds it together so that we can keep our eyes on it so that we can fully understand what the patient and the family are wrestling with, what they're trying to decide, and what we're trying to deal with as well. Next, we have to determine what are the guiding values and virtues in this. So again, a value is an individual belief that motivates a person to act in one way or another. And a virtue is, what kind of person am I becoming? What is the character quality trait that I want to be? Who do I want to be? What type of person do I want to be known as? So a value might be that each and every person is treated with dignity and worth. That's a value. That's a belief that leads you to act in a certain way, to treat people with dignity and respect and worth. A value might be the value that that we have the right to make our own healthcare decisions. That's an American value, that we have the right to make our own healthcare decisions, and so we value that. That may be a very rock solid. That might be one of the main reasons you got into healthcare, was that we have the ability in this country to decide for ourselves what direction we want to take our own health and our own life. Another value might be that I'm motivated by a belief in a higher power. I'm motivated by belief in God, or a value that I believe that the Bible is a viable religious text that gives me the guidance I need to understand God's plan for my life in this world. And so that's my value, leads me to act in a certain way, which is to align my actions and my attitudes with what I get from the Bible or another holy book. Virtues, on the other hand, again, that's the personal character. What would you want people to say about you at your memorial service? When somebody is saying your eulogy, do they want to say that, my friend Roxanne, I worked with her in 2024 at the Sunnyview Acres senior retirement community, and she was a rock star. She was the most kind, compassionate, loving CNA that I'd ever worked with in my 40 years of healthcare. And she had a wicked sense of humor. She could have us laughing in one moment, and then she'd have us in tears with such a compassionate and gracious heart in the next. So those are the virtues of compassion, of graciousness, of humor, of love and respect for other people of all walks and talks and stages and ages of life. So again, we're determining for the person, the patient, the family that's looking into this decision of process of what do I do with this end of life journey. It's so critical that we see what we can do to help them determine their values and virtues. And then we as healthcare team members have to look at our values and virtues and what they help us to navigate this situation. And then we explore alternatives. So again, there's lots of possibilities, lots of different alternatives that can take place depending on the situation. And every situation is different depending on where a person comes from with their values, their beliefs, their virtues. So each and every patient and family who's facing this terminal illness, whether it's cancer, whether it's lung disease, whether it's heart disease, whether it's Lou Gehrig's disease, whether it's Huntington's, whatever it might be, they're going to navigate this in their own unique way. And so our job is to really help explore with them and then explore for ourselves what are the alternatives and options for their care. So hopefully, for instance, if someone was diagnosed with stage 4 pancreatic cancer, they were hopefully able to meet with very skilled and compassionate and brilliant people who could help walk them through. For this type of specific cancer, here are the treatment alternatives. Here are the options that we can begin with. Here are the trusted, most reliable, fully approved alternatives. And then here are what this specific cancer center is working on in terms of alternatives for research treatment if the first line of defense isn't available. So we want to help these people look at each of these pathways and continue to have conversations to make sure that they're aware of all the alternatives and options that are in their care. Even if someone's on hospice care, we recognize that they still have the right and the option to choose to get off of hospice care at any point in time and seek aggressive treatment if that's their choice. They have the choice and the option to receive as much medication to palliate and ease their symptoms as possible, even to levels that would normally be thought of as unacceptable, not hastening death in hospice, but we're really there to provide as much optimal comfort and support as we can. And so again, we need to let people know all their options, and we as care team members need to know what our options and what alternatives we have. And often these are very difficult but courageous conversations. You'll hear me say this multiple times. We want to have courageous conversations, honest conversations about all of this process. And so that might mean just being willing to be vulnerable and acknowledge that you're not really clear about what all this means. Or it might be just being honest that your values and beliefs are already set in a certain way, and you just need to be honest with yourself, be honest with your colleagues that this is already what I know to be true about me and my values and my virtues. And I understand that there's lots of alternatives, lots of options, but I'm really only going to select a small amount of those alternatives or options that I'm able to participate with. So as we look at all the possible responses, we look at everything going on here. Again, we're diving into specific options for patients and team members. So here's some ideas for you. So patient options, if they're given a terminal diagnosis, they have the option to live with blissful denial. They don't have to accept anything. I've known so many people and met so many people in my career with hospice that have just continued to live with blissful denial, even while signing up for hospice and acknowledging that they have a terminal diagnosis. Again, there's the option and the right for people to fight the disease at all costs. There's the right and the option for patients and family members to seek alternative treatments, second opinions, trial research. There's options for people to choose comfort as their goal as they receive a terminal diagnosis, whether that's their loved one has reached the terminal phase in their Alzheimer's, whether that's their loved one has reached the terminal stage in their cancer, or some other reason, just old age, made it to 110 and nothing works as great as it used to be. They have that option, whether they're 30 and terminally ill or 110 and terminally ill, they have the option to choose comfort as the goal, elect palliative care or hospice care, depending on what their goals align with. And they also have the right and the option to stop eating, drinking, and taking unnecessary treatments. Voluntarily stopping eating and drinking is similar to being choosing while someone is on a respirator in the hospital to be unplugged from the breathing machine, literally pull the plug, be taken off life support, and allowing that person to pass away naturally. So voluntarily stopping eating and drinking may speed up the process of someone making their end of life journey, but it's often an alternative that some people feel aligns better with their values and their belief systems if they're not in alignment with a medical aid in dying program. And again, there's the choice to choose legal medical aid in dying. This is not euthanasia. We're not hooking people up to an IV drip and putting them out of their misery. That is still illegal in all 50 states in the United States of America. These are specific programs and policies and procedures that allow a person who has capacity to make their own healthcare decisions to work with a medical doctor and medical team to get prescribed medication that, when taken, will ultimately end their life. The team members, you all as team members, as healthcare heroes, you have the option just to keep business as usual. You know what? I'm not getting into this. This isn't my role. This isn't my lane. I'm staying out, business as usual. That's fair. That's okay. There's a place for that. You also have the option to explore your own values and virtues and see how they relate to this issue. I highly hope each of you would take that option, whether you're a cook in the kitchen or you're an ICU nurse or you're a volunteer with hospice, whatever your situation, whatever your lane is. I would highly encourage each of us to explore our values and our virtues to see how they relate to this issue. And I'd highly, again, encourage you, have that courageous conversation, talk to your supervisor, gather the facts, explore all the possibilities, understand as best as you possibly can to know what this is all about, understanding the shoes that the patient and the family member are living in, understanding the dynamics of your particular environment that you're serving in, and understanding your own values and virtues. Again, have those courageous conversations. It might be that you need to, reach out to a a religious leader. You need to reach out to a rabbi or a priest or a minister friend or somebody in your life that you can have these conversations with. And then if appropriate, and if you have that type of relationship with someone who's really walking through these options, you can ask them, as a hospice team member, I think it's perfectly fine at the very beginning of our care with families is often to sit down with them and say, now tell us what you're looking for. Explain to us what you know about your prognosis, about your disease process, and tell us what you want. Tell us what you're looking for. Paint the picture for us so we can see clearly exactly what your goals are, and so that we can get that in our eyesight to be able to help them to clarify these desires and know what best can be done to help them. And then again, please choose to care. Always, always, always choose to care. Even if you're walking to the side and not actively working with someone who's choosing a MAID program, that's still choosing to care. You're still respecting that you're in alignment with your own values and your own virtues, and you're not dismissing people, you're not disrespecting people, you're not putting and pushing values on people. You're really choosing to care in a way that agrees with your values and virtues, no matter what decision you make in terms of how you can help or how you may need to step to the side. What we don't want to do, what would absolutely wreck a situation where someone's already in this fragile heart situation, is if we treat them with disrespect, disgust, rejection, aversion. We just escape. If our option is to just escape, we're just run away. That's not going to be helpful. If you choose to step to the side because you're aware of your values, your virtues, your own moral and ethical conscience, that's a very respectful and honorable choice to make. But escaping and having disregard and revulsion over a person and their choices is not respect. It's not love. It's not honor for this person and their family member in this very difficult time. So what we do need to do is we need to compare all of this. So we've gathered these facts. We've looked at with curiosity. We've framed the picture. We've began to understand the values and the virtues for the patient, for the values and the virtues for ourselves. We've looked at all these possible options that are on the table, and we begin to eliminate those alternatives that don't align or don't fit with either our values or what's best for the person. And we compare these alternatives again to the highest core values and virtues. So for you all as healthcare team members, you may automatically take MAID and supporting someone who's going through the MAID program off the table. You just know without a shadow of a doubt, you're 100% certain that that choice does not align with your virtues, your values, your belief system, your ethical and moral stance, and you will do your best to honor and respect people, but you're going to have a courageous conversation and choose to step to the side and not participate in the care for that person. Again, that's fair. That is a wise and caring and honoring way to approach this. But you also, on the flip side, might be a person who says, well, why wouldn't I support someone? Why wouldn't I go and be with them as they're pursuing this? And again, that aligns with your values, your virtues, your choices, your decisions. And that's wonderful. Go for it. And we just want to make sure that we're always basing these decisions off of our values and our virtues, our core ethical foundation, our core moral, ethical North Star, so to speak, and make sure that our values and virtues are respected and that they're driving the decision. And then we want to help the team and the community. We want to help you respond. We want to help you show up well. And that we want to help you process this with clear values and virtues. And again, it's fair. This all may seem very muddy and confusing, and you're not really sure where you stand or how you could help or not help, and what's all this about. That's fair. Again, we want to help you process this. We want to help you reach as much clarity and direction with vision, values, and virtues as we possibly can. And so what are the results? What are we looking at here? What we're trying to aim for is to achieve the most honorable, the most dignified end-of-life journey as possible for someone that aligns with their moral and their ethical value system. And we want you all, again, as healthcare heroes, to make sure that you're in alignment and you're making decisions that have the best results for you. We don't want to add any extra stress to your plate. We don't want to add any more distress or moral injury to your heart and your soul. We want you to be confident and secure that the choices you're making are leading to the results that best line up with, again, your moral and ethical value and virtue system. So we look at the consequences. We look at all the options. We've eliminated some options. We've accepted some options. We've dived into this. We've gathered as much clarity as we possibly can. We've thought about it. We've conversed about it. We've discussed it. We've taken it into our own self processor, whether that's through prayer, whether that's through meditation, whether that's through seeking counsel from a wise, trusted source and friend. We've taken all this into consideration. It's time to look at both the negative and the positive consequences here. So if a person who is uncertain about where they stand about aid in dying and taking things into their own hands to intentionally end their life, if they're uncertain and they feel pressure to go in one way or another, then we're not easing their conflict at all. So we want to make sure that no matter what, we're not pushing and we're not putting our agenda into the mix. We want this to be that person and that family member's decision. Because if we're the ones that are pushing and encouraging and planting all these seeds for them to go in a certain way, the results are they're going to be very conflicted. They're not going to have a peaceful end of life journey. Nor if you are not clear on your resolute direction, you're not going to have a very peaceful experience trying to help people who are navigating their end of life journey. So again, we're thinking about our highest values and virtues. So if you are fully on board with someone going through an aid in dying process, you still have to be very clear about where your level of emotional and spiritual and mental and physical health is in that point in time to evaluate, am I really at a place where I can help this person, be there with this person in this very intimate, difficult decision-making time? And if the answer is yes, then you're choosing to go forward in the best way that you possibly can. And if the decision is, you know what, I'm on board with this, I support this, I want them to experience what they want to experience, but I'm just not in a healthy place. I'm not in a good place. This is going to really tap me out. That means I need to act in accordance to those realizations and make sure that I'm making a decision that's going to have positive results for both me and the people I'm working with by choosing to sit maybe more on the sidelines or sit in a more passive role rather than a more active role, because I need the time to make sure I'm in a good place before I step in to try to support people through this. So we look at the positives, we look at the negatives, we help these people look at all the options that are on the table. And we're really at the final stage here. We as healthcare team members have to get real clear again, where are we choosing to on-ramp and where are we choosing to off-ramp? Where are we choosing to ramp up to get on board with somebody as they're choosing MAID? Or where are we on-ramping to get on board and support someone as they're choosing not to pursue MAID? Where are we taking an off-ramp if we realize that it's just not in my value system to support someone through MAID? I need to find the most respectful, compassionate, honest lane to get in that allows me to respectfully step to the side. That's an off-ramp. Or again, I fully support someone going through a MAID process, but I know in my heart and soul I'm not at a place where I can do this. I need to respectfully find that lane, off-ramp, take a seat on the sidelines and make sure that I'm supporting in a different way. So that's part of just, again, looking at this, looking at what's going to bring about the most positive results, whether you're helping or stepping off, whether you're in agreement with someone following through with a MAID program or you're in disagreement with someone going through a MAID program. Ultimately, we're choosing the appropriate on-ramp and off-ramp for that particular situation and respecting that your decision-making might change the next time that this time comes along. So it's decision time. It really does finally come up to what are you going to do? After you've considered all of the scenarios, after you've looked at all the options, after you've considered your values and virtues, after you've looked at what's the positive impact I could have, What's the negative impact I could have depending on what I choose to do or not do as a healthcare team member? We're just being clear on your personal decision and why that is your personal decision, because we want this driven from your values and your virtues. We want this driven from your moral compass. We want this driven from your belief system, your higher power, and we want to respectfully then move forward, all the while continuing to allow time and space to keep processing and grieving. Again, we need to help our families, even if they're choosing to participate in the MAID program. We need to help them have the time and the space to process their grief, process their experience, process, why they're making this decision. And all along the way, it's so critical as healthcare heroes that you nurture your well-being, heart, soul, mind, and strength. Nurture your well-being. Be tuned in to the level of compassion fatigue you're already at. And if you already are at a critical low level of compassion and empathy, and you're about to go to code red level of zero compassion and empathy, what's it going to take to fill your cup up so that you can show up and be there as the best self to support these people during their time of need? The decision is yours. Ultimately, I can't make that decision for you, just like I can't make the decision for a family member or an individual who's facing an end-of-life journey, who's in a state that allows medical aid in dying as a choice for their end-of-life journey. Can't make that decision for them. It's not my decision to make. The best thing I can do is ultimately walk through this process in a thoughtful, respectful, intentional way, all the while having these courageous conversations and being truthful and honest about what are the on-ramps I'm going to take and what are the off-ramps I need to take for whatever reason. Again, those reasons might shift and change person to person, time to time, situation to situation. But again, we want to be clear on your personal decision and why. We want to respectfully move forward to either actively support someone as they choose MAID or actively support someone as they don't choose MAID, or another alternative for their end-of-life treatment. We want to, again, respectfully move forward with them. And we want to respectfully choose where those on-ramps and off-ramps are so that we allow time and space to process the grief and the grieving that takes place during these difficult times. It's exhausting. It is exhausting to go through the end-of-life journey for so many people, for so many reasons. And even for you, walking alongside of people on the end-of-life journey, it's exhausting. So please nurture and take care of yourself. Again, this might raise a whole host of questions that I haven't been able to answer for you today, and that's okay. I hope that you'd reach out to someone that you trust. I hope that you'll have courageous conversations. I hope that you'll continue to ask the hard questions like why and how and what does this look like? And I don't understand this. And can you help me process what the thinking is behind this choice? Again, ask the questions. Don't be afraid of the questions. Don't be afraid to be curious through this whole process, because ultimately that's going to allow us to show up better and help these people have the most dignified, peaceful, respectful, and loving end-of-life journey as we possibly can. Thank you again. This has been MAID and its moral impact for healthcare heroes. For all of you in the trenches of helping these people face the end-of-life journey, thank you. Thank you for your love and support, and please reach out if you have any questions or concerns. It's a pleasure being with you.